Well, thank you for having me. It's been an amazing session and I've been learning a lot. So it's fantastic to be here. So we'll talk a little bit about leveraging AI for enhanced health outcomes, but I'll try to go more into a little bit of what is AI, and hopefully I will be able to bring a little bit of that vision to you in a really short amount of time. So AI essentially tries to emerge intelligence from computer systems, making computers smart. But one thing that not all of us know is that we mostly just mimicking the real world. The subject that really got me into artificial intelligence many years ago was evolutionary algorithms, where you create an artificial population of digital beings and you reproduce them, and you're constantly analyzing their fitness to that environment based on the solution that the genes provides to a certain problem. And you reproduce, you create a new population, you do it over and over again, and we generate then millions of generations of individuals. And they do evolve. They evolve over time, and they get to emerge really good solutions for complex problems. So this is still an area I'm very passionate about. Neural networks are a type of artificial intelligence that also mimics the real world. That is something that we've been using a lot more in the last few years. And I find it amazing how it all started from a professor of neurology trying to create a digital neuron so he could better understand, better study it. And then someone saying, well, what if we put a bunch of them together? Would there be like a little brain? Would it be able to learn? And yes, absolutely. So fascinating how those things emerge. But in essence, neural networks are also trying to mimic the real world. They are chains of neurons put together in different organizations. And if we look at some of the common types of applications that we use nowadays with artificial intelligence, something like natural language processing, and probably the most famous one nowadays is ChatGPT. That uses a certain architecture of neural network, a certain composition and a way that the neurons are arranged that is highly specialized and they're highly efficient for language. While other types of artificial intelligence, say like computer vision, will have a different structure, a different way that those neurons are put together. That in that case then is highly efficient for handling vision. So it's fascinating that applications emerge in mimicking a tiny part of our brain, and perhaps at some point we'll be able to put all those things together and make a fully capable brain. We'll see. But with that super short background in artificial intelligence, I think it's really interesting to look at, and this is something we do constantly, to look back at the challenges of healthcare and try to have a critical eye into how those things can perhaps be improved by the use of technology. And it wouldn't fit the screen if I were to list all of the challenges, so I just picked a few that are constant, they're pressing, and they're emerging, like unequal access to healthcare, and not just patients having unequal access to healthcare, but just looking at the my colleagues today, also healthcare workers having unequal access to training, drug-resistant organisms, and the threat that they pose to mankind, and aging population, and perhaps deeply connected to this, but not necessarily connected, mental health as well, and rising costs. So there are many things, and some of those things are perhaps a bit more obvious than others, but I really like to always look at the status quo. What are the things that we have been doing the same way for many years, to the point that we don't look at them as problems anymore? We look at them as it is the way it is. It has always been that way. And the best example that I can think outside of healthcare, and most of us will relate to this, is remember back in the day when you'd be driving and you want to get to a place and you don't know how to get there, you would stop and ask someone for directions. And then you drive a couple of kilometers and you stop again and ask for more directions. And eventually you get where you want to be. Or in some cases, you would even have a map in your glove box that you could pull and try to figure out where you are, and then try to figure out how to get to where you want to be. And that is the way it has been was done for many, many, many years, and nobody minded it until the day you saw a GPS navigation system. And when you saw that, the act of stopping and asking people, the act of having to pull a map, became a huge problem, a huge pain point. So you had then been disrupted by this new technology right there, even before you adopted it. That status quo, that way things have been done, was not good enough anymore. And I really like to look at those things and see how we can change, how we can improve some of those things, because they may bring some huge efficiencies. There are a range of solutions that can be brought to healthcare by leveraging artificial intelligence, and you're probably familiar with many of them. Things like diagnostics, early diagnostics, or even different methods of diagnostics, and personalized treatment plans, and optimization of resources and similar things. But one thing that I am particularly passionate about is the AI that comes out of the data center and gets into the front of the stage on the day-to-day practice. AI that you can interact with, that you can touch, that you can talk to, that you can really engage as a tool for you, end user. And I think this is also important, and this also connects to that status quo. While some of those big, hairy problems are super important, and I'm glad that there are organizations working on early diagnostics of different types of cancer, and that is absolutely amazing. It is also important to look at what are the actions that we can do that can cause that immediate impact on our day-to-day practices, and that can then help streamline the healthcare system, can optimize the way we spread knowledge and other things. So with that in mind, I think it's also important to mention this aspect of augmented humans. And human augmentation using AI is essentially about a philosophical approach to AI, where you come thinking, how can I make the people, the experts that are doing this work better, instead of how can I replace them? And I like to think that it's silly, the idea of trying to replace experts, and invariably it's doomed to fail. But when you're thinking in enhancing people, in making them do better, how can I help a clinical educator to train 5,000 people in the morning? How can I help them to visit 100 small clinics in a single day? How can I help them be in 3 different countries on the same day? And technology can absolutely help with all of those things. And it clearly connects with some of the challenges shared by the colleagues that spoke before me. So this is our angle, this is our philosophy, this is the way we look into AI. And I have heard from a considerable number of people saying, well, AI is the thing in the future, and it will eventually help us. Well, the future is now. AI will completely change the way we live and the way we practice healthcare in the next 10 years. It is already changing drastically. It is having a very big impact, and the future is now. It is time to embrace technology and not carry a map in your glove box. Thank you very much.